During the first few weeks of life, your baby will sleep a lot, usually about 16 to 17 hours a day. Sleep helps their brain develop. But newborns sleep lightly and eat often, so they may only sleep 1 to 2 hours at a time. Your newborn does not yet know the difference between night and day. As a result, your baby's sleeping pattern will be unpredictable. It will be hard to make your baby sleep more, less, or at certain times. Since your newborn is feeding every 2 to 3 hours, you both will be awakened often in the middle of the night. But at around 2 weeks, you can help your baby start to recognize when it's time for sleep. You can create a sleep routine. Here's how. During the day, play with your baby more. Spend time talking, reading, and playing together. Keep the lights on, or open the curtains or blinds. You also do not need to be completely quiet. Ordinary noises and activities can encourage your baby to be more awake during the day. At night, designate your baby's awake time for feeding only, no playtime. Keep the lights low and calming even when feeding or changing your baby. And although you are tired too, do not fall asleep with your baby after a feeding. Put your baby back in a crib or bassinet to sleep safely. To review, try not to wake your baby when you feed or change them at night. Put your baby to bed when they are sleepy. This will help them learn to fall asleep on their own in their own bed. If you hold your baby or rock them to sleep, it may be hard for them to go back to sleep if they wake up. The safest sleeping position is on their back. Healthy babies should not sleep on their stomachs. Do not buy a sleep positioner. Most are unsafe and not needed. If your newborn has had problems with breathing or other problems, check with your child's healthcare provider about the safest sleeping position. Because your baby is spending so much time lying in one position while sleeping, the back or side of their head may look flat. Switch head positions when putting your baby to bed, and give them lots of tummy time when being watched awake. This is good for the head and also encourages upper body strength. When your baby lies down to sleep, use this time to rest yourself. You deserve it. It may seem never-ending, but this period of unpredictable sleep patterns will soon fade away. As babies get older, they begin to sleep for longer stretches of time. For now, though, get rest when you can so you can enjoy the times when your baby is awake. It can be very scary when your baby is sick, especially if your little one has a fever. Fortunately, most of the time, you can treat your baby's fever at home, but here are some guidelines on when to call the doctor. 1. Call your doctor if your baby is younger than 3 months old and has a rectal temperature of 100.4 degrees or higher. Your baby will need to be evaluated by your doctor right away. 2. Call your doctor if your 3 to 6 month old has a temperature of 101 degrees or more. 3. Call your doctor if your child has other symptoms in addition to a fever, including drowsiness, severe ear pain, that could mean an ear infection, vomiting and diarrhea, that can increase the risk of dehydration, decreased wet diapers, and crying when urinating, which can be signs of a urinary tract infection. 4. If any fever lasts longer than 3 days, call your doctor and have your baby checked by your pediatrician. If your baby is less than 6 months old and has a fever that climbs to 104 or 105 degrees, seek medical help right away. If you notice your baby has severe shortness of breath or is lethargic, call 911 immediately. Having a sick baby can be scary. Call the doctor when your baby is less than 3 months old and has a temperature of 100.4, your 3 to 6 month old has a temperature of 101 or more, your baby has other symptoms as well as fever. The fever lasts for more than 3 days. And call 911 if your child's temperature climbs to 104 or 105 degrees, or if your child has severe shortness of breath or is lethargic.
Different foods can have different health benefits. By making informed choices about what we eat, we can improve our health and well-being. Who doesn't love peanut butter and jelly? But is there a way to improve on that traditional sandwich? Well, adding real fruit instead of jams or jellies is a small change, but can have a big benefit. I show my good friend Don Saladino one of my kids' favorite breakfast meals. That's right, sandwiches are not just for lunch.
It's called the peanut butter and jelly sandwich.
It is not the peanut butter and jelly sandwich. It is a peanut butter and strawberry.
I love this, by the way.
Grilled toast.
For me, this is a perfect pre-workout snack.
Yeah, you have the protein, you have healthy fats, and then you have fruit. And we think about it for lunch, but we actually should consider it for breakfast as well.
I like it.
All right, Don, let's get some strawberries here.
So typically, I try and buy organic, but sometimes I don't always have access to organic. So
I don't get too focused on organic. I'm fine. People can use fresh, they can use frozen. It's just most people aren't eating fruit.
when I'm making different dishes, I like to make sure that they're colorful. How do they taste? Good?
Very good. I don't want you using white bread. What I want you to use is something like whole wheat bread. You can use something with seeds. That's what we're going to use
Ezekiel,
today.
something sprouted,
Sure.
something powerful.
You just don't want to use white bread because that has very little nutritional value.
We're doing peanut butter and strawberry slices. And we're gonna crisp this up a little bit, right?
We're going to grill it.
So now we're gonna throw the top
That's right.
on.
What I do is just put one on top of the other like a sandwich. 2 minutes this side, flip it, 2 minutes the other. Voila.
We're gonna fire up our grill.
All right.
We're gonna use about a teaspoon of olive oil. We're gonna lay that down and we're gonna let it cook. We wanna cook this until it's crispy, it's golden brown on each side.
You could do that or set your timer for 2 or 3 minutes each side.
Or you can
and
do that,
flop it.
right.
Very nice.
It's almost like I've never eaten a grilled cheese in my life. I don't like grilled cheese. But this nice golden brown right now, this is delicious. I am done with this. This is fantastic. We are ready to go.
All right.
Beautiful. I am not a fan of doing a lot of dishes. So why go grab another knife, even though we have one there? We can just use a spatula.
Let's see if this works.
This will work, I guarantee you. So we're gonna go from here. Boom. Look at that.
All right. Let's give it a taste.
Oh my God. Ready? That is very good.
Your baby has a lot to learn about the world around them, and their fast-growing brain is ready for it. The first 5 years of a child's life are key in their development, and you have a crucial role to play. You are your baby's first teacher. You get to teach them how to interact with others, use language, and solve problems. To help your baby learn and grow, talk, read, and sing to them. Encourage playtime. Give them a safe place to explore their world and respond to their needs in a predictable, loving way. With lots of love and support, you'll teach your child how to thrive.
As a mom, you really want your child to reach those milestones, so you're constantly looking to make sure that they're hitting those markers. But you really should enjoy those times. I started to realize that instead of stressing out about those moments, they will get there when they're ready, and you look at your child and you want to just enjoy every moment of them. After having my first child, I was so worried about every milestone, and this time I've taken a step back and just enjoy my son and watching him grow and at his own pace.
As your baby grows, they will have lots of firsts. Their first smile, first laugh, first steps. These are called developmental milestones, and they can help tell you if your baby is healthy and growing up well. Keep in mind, milestones are not fixed. All babies develop at their own pace. But by knowing the milestones, you can spot a problem early if it arises. Follow this checklist to recognize milestones. By 2 months of age, most babies will do the following. Respond to you by smiling at you or calming down when you talk, looking at your face, or watching you move. Do make different sounds besides crying, such as babbling. Do react to things in their environment, such as briefly looking at a toy or flinching at a loud noise. Do hold up their head when on their stomach. Do not wait to talk with your child's healthcare provider if your baby does not do these things. Also note if your baby does not follow moving objects with their eyes, does not open their hands, or has trouble moving both arms and legs. These could be signs of a delay in development. Your child's healthcare provider can test your baby's progress. In most cases, missing a milestone turns out not to be a problem, but being vigilant can help you act on any concerns quickly. Follow this checklist to make sure your baby grows up healthy and happy.
Today's health tip.
Dressing can be a fun way to bond with your newborn. When dressing your baby, choose clothes that keep your baby comfortable. Your newborn is not yet able to regulate their own body temperature. In the summer, a t-shirt and diaper or single layer may be enough. Also keep in mind, cotton breathes better than polyester, rayon, or other synthetic materials. In the winter, dress your baby in the same amount of clothing that you wear, but add one more layer. Also, choose clothing that makes dressing easier for both of you, such as outfits with loose shirt sleeves, fasteners down the front, and stretchy material. At bedtime, one-piece sleepers or pants with feet are best. They help keep your baby warm. Following these tips can help you choose clothing that is both cute and comfortable for your baby. Now, a health minute. After having a baby, you may expect to feel a strong emotional connection with your child right away. But sometimes that's not the case. For some parents, bonding can take a bit of time, maybe even days or weeks. To help build a bond with your new baby, try these tips. Touch skin to skin, such as resting your baby on your chest. Make eye contact often. Read, talk, or sing to your baby. Mimic your baby's sounds. Take part in feedings, or give your baby a bath. Bonding is a process. Interacting daily with your child will build and strengthen your bond over time.